So I'm going to go ahead and say hello. I am Nicole Katz. I am the Director of Wellness for Union Square Play. I'm also a yoga therapist and a mommy of two little babies. They're not little babies anymore. They're 3 and 5, but they are my little babies. But my experience of birthing them and of being pregnant with them and of trying to become pregnant with them just turned on this passion for me of working with moms and supporting them in any way I can through this entire process. So I am so excited to be here talking about the last 40 days of pregnancy. And I teach an expectant moms group for Union Square Play. And this is kind of one of our sessions come to life. We always have a session that is, how do we prepare for those first 40 days and the last 40 days? And actually these beautiful women who are here with us tonight have all come individually to speak to my mamas, but they are here together as a superpower panel for mamas to talk about kind of this last stage, which we are so ready for baby to be born, and yet so terrified to do something, especially first time and even second time and third time and fourth time, fifth time, however many times you birth the babies, to do a really terrifying, really scary thing. And that anxiety can really build on itself. And what I hope to give us tonight with these beautiful women who are here are a lot of doable, checklisty sort of things that we can be doing in these last 40 days to not only burn off that anxious energy, but also to really set ourselves up for a beautiful first 40 days with baby. I think a lot of us have this idea that it's going to be calm and lovely and easy and nurturing, and we want that sort of situation. And then when it doesn't happen, we feel like and somehow that we have failed. And the reality is that kind of thing doesn't just happen. We need a tribe to help it happen. And for most of us living the way that we live now, we don't have a tribe in that same way. And so we as moms can really do a lot with our partners and with our family members, right? We can reach out for help is a big part of this too, to set ourselves up for success in those first 40 days, which, spoiler alert, is a huge win in mommyhood in general. And it's a skill that if we learn it ahead of, the earlier we learn that if we prepare, we get to enjoy the thing. I remember the first Halloween that I had Isla, if you look at the pictures, it's bad. The costumes are bad. I look angry. Jeff looks ridiculous because I thought, oh, you can do this a week before like I used to. And then the second year I was like, oh, I'm getting Halloween costumes in August. And then you get to enjoy it. So tonight is about preparing and utilizing that energy at the end to really set ourselves up for a beautiful experience in that sacred first moment. So that was a lot of intro. I want to introduce you to this panel of women who have all in their own right influenced my motherhood journey in a really big way. We'll kick it off with Dr. Gabrielle Francis, who I've known for, it might actually be 15 years, naturopath, acupuncturist, chiropractor, and just powerful woman extraordinaire. Thank you for being here, Dr. Francis. Did I miss anything in that intro?
No, but thank you, and thank Catch, and thank Union Square Play for putting this together. And I really admire you. I'm really excited to be able to share this information with people.
Yay! We also have Miss Flora Cohen. Flora and I became intimately acquainted right after the birth of my first daughter, Isla. Flora is a magical pelvic floor PT who's in private practice here in New York City. Dr. Gabriella, all three of these women are in private practice in their own way. You will get their contact information. But without further ado, Flora, welcome.
Thank you.
It's so lovely to have you tonight.
Great to be here. Thank you for having me. I'm really happy to share with all of these great women and talk to all of these wonderful moms to be tonight. So I hope that we can just help demystify any questions that you may have. And hopefully, if you have any questions, just put them in the chat box. There's no question that's off topic or too taboo. So please feel free to use this time.
I love it when Flora comes talk to my mom. She usually starts with, guys, I'm going to say the word poop. I'm going to say vagina. I'm going to say pee. Let's just kick it. The gates are just kicked open. There, we are in it. We are here. We are in it. There are no questions that are off limits. No questions too silly to ask. And then lastly, but certainly not least, Miss Elizabeth Barron, who is with us, who is a mental health counselor, we met most recently for me But just the first time I heard you speak to maternal mental health issues, I was like, yes, this is a woman who I need to bring to other women, to just normalize the experiences of motherhood that we can, I think, put in a shame box because we don't think that we're allowed to have dynamic feelings as women. So I'm so proud and so excited that you are here with us. Did I miss anything, Elizabeth?
Zippo, thank you, Nicole, as always. I'm so thrilled to be here. And yeah, like Flora said, I mean, and Nicole, everything goes here. Like nothing's scary. No thought is too big. No thought is too scary. It all goes. It's all normal. And I can't wait to talk. So thanks for having me.
Yay. Okay, so I did say this before for anybody who missed it, though. We will have Q&A at the end. You can feel free to submit your questions down there in the chat. You can submit them with the Q&A function if you want them to be private. You can also chat me directly and ask them anonymously, and we'll try to get to as many of them as we can. And I'm sure any of them that we don't get to, these lovely women will be happy to answer, and you'll get, again, all their contact information and ways that you can reach out to them. So welcome. Okay. I remember, so Tina, who is Anthony Rudolph, one of the co-founders of Union Square Play, her and I were pregnant at the same time. She was a little bit earlier than me. She was due earlier. And towards the end, she sent me this article that talked about this last stage of pregnancy in a really beautiful way that I think I will forever be grateful to her for sending that to me before I was in this period. So before I got there, I had a heads up that, listen, the end is going to be a little funky. You're going to have one foot in your old life and you're going to have one foot in your new life that you can't possibly comprehend no matter how hard you try. You're going to be on the verge of doing the hardest thing you've ever done with no context for what that means. And really only your partner will be able to understand what that's like, to wake up every morning and be like, is today the day? I don't know. It's today the day. So even the knowing that it's okay and normal for the last stage to be uncomfortable, I think is really important. And first and foremost, there's nothing wrong if at that end, whenever that means for you, there is discomfort. And I think it's important to recognize that discomfort is also a part of motherhood, right? There's a lot that we can't control, a lot of big feelings we have to hold space for. And just being comfortable with discomfort, I think, is also part of how the process trains us for motherhood. And just to hold space for that without attaching to it as being bad, I think is a good precursor. There's also a lot of energy. And once you've also unpacked all the onesies and the diapers and you're like, is this baby here yet? Is this baby here yet? There's a lot of things we can do. Okay, so here ensues a giant checklist that I give to all my mamas in my groups that I hope will be of service to you. I always start with mentioning food, and you guys feel free to chime in here with your own experiences. Dr. Gabrielle asked you for some actual ingredient resources in a second, but it seems silly. But especially in those first 2 weeks, you don't know what time of day it is, where you are, you barely know who you are, liquids are falling out of places, things might be falling down, you're trying to figure out how diapers work, it is just a blur. And feeding ourselves in that time is so important that if we put just a little bit of attention previously or before baby is born, and I know this sounds corny, I didn't do it the first time, but I cannot recommend it enough. Freeze some things. The second time I freezed like 4 dishes, and just having a few dinners that were real food that we didn't have to think about was magical. So freezing of food is a big one. Another one that I think is really important is, especially in these COVID days when we can't do visitation the way that we want to, we'll get to that in a second, asking family and friends to participate is a way that we can commune in those early days. And there are some great, and actually Sandra, maybe you'll help us get that link. There's a great way that your friends and family can sign up to drop off dinners and things like that. Just like a little bit of insight. And it's funny, Dr. Gabriella, I don't know if you remember this, but you were the one who told me back in the day to make sure that my partner, Jeff, was in charge of food. Like I could assign, because we're not the only ones feeling weird at the end, right? They're also feeling weird and they really can't do anything, right? And giving partners an assignment can be empowering for them as well. And saying to partner, figure out food, freeze 4 or 5 meals, make me some Labor Aid, make me some breast milk cookies, and get 10 of our friends to sign up to whatever it is. And then they have a doing thing. In the interest of time, I know we can't deep dive into this too much, but Dr. Francis, and just cooked foods are very nourishing, broths and things like that. Are there any other like go-to things that you would say in terms of ingredients or kinds of foods that are really nourishing and healing?
Well, what you want to think about is that the woman's body is just, the baby's been charging off of her batteries and living in her garden for the last 9 months. So after the birth, she's fairly depleted. So we need to replenish the garden and give her the nutrients she needs so that she can not only heal herself, but she has the proper nutrients for the baby for breastfeeding. And the two things, it's fat and protein that actually are the most building, which will be helpful for her building, but also what the baby wants the most from the breast milk is fat and protein. Fat and protein is vital for the development of the nervous system and the immune system. And the more fat and protein that that she eats, it comes through the breast milk. And the more fat and proteins in the breast milk, the more satisfied the baby is because their blood sugar will be balanced, right. And the less often they'll need to feed. The less often they need to feed, the quicker she can actually recover.
Right,
so I usually recommend that you put lots of nutrients together, lots of little snacks together and things in the refrigerator that are easy for fat and protein. Hard-boiled eggs, cheese sticks, cottage cheese, yogurt, nuts, nut butters, meat, and things like that. And then avocados, olive oil, flax oil, those kind of things. And then it is difficult to get the fat and proteins. A lot of times you want to go for carbs, they're easier. So I usually recommend that the carby snacks people go for are also things that have protein in them, or even the carby foods that they want. Like if it's going to be pasta, make it quinoa pasta because that has protein. If she wants bread, make it sprouted grain bread because that's 10 grams of protein as well as the carbs. So we have a list to give people.
Yeah, I was gonna say, so we'll send you guys a list with a lot of these details in it, but I love that idea of just like between you and partner, and primarily partner if it's possible, because mama's already doing a lot, just have food be something that you're working on to take care of you, at least in that first week. Because to that, the good fat and high protein is generally not in the thing we're going to order from wherever we're ordering food from in that last minute when we just want to eat something. And it also just doesn't feel as nourishing and healing, right? So food
plays the snacks in advance, like keep them in the refrigerator, prep the snacks in advance so they're easy to grab.
Totally. And talking about that, actually talking about it together, here's a granola bar I really like, so that in the moment when you got a 5-day-old, your partner's not trying to give you something that you don't like, and then he's upset or she's upset that you're going back and forth when it's a granola bar, but it's not just a granola bar. It's like anything is a moment. So food is something that I think is a big thing that we can pay attention to in that last chunk of time. The other thing, this was actually when Elizabeth and I were talking yesterday and prepping, something that I was talking with my moms about last year that we kind of were luckily enough, felt like we were able to ebb off of a little bit, our COVID visitation plans, right? We are in, and you mamas who are giving birth right now are just incredible women and dealing with so very much and are so strong. And this concept of who gets to come see the baby? How are they going to come see the baby? Where do we feel comfortable? Where do you feel comfortable? What are the current guidelines? That's a beast, right? It's a beast in general. Your mom can, my mom can't, my sister annoys you, your brother bugs me. Like that in and of itself, just in non-pandemic time is huge. And so having a conversation, and I have a little template that I created with my sister when she was having her baby that she sent around in the end of pregnancy to everyone, to family and friends, so that there was an understanding about what was needed, and you could have the uncomfortable conversations before you have a 2-day-old and somebody's at the door but can't come in, or you have a 1-week-old baby and you don't feel comfortable giving them to someone. There's a lot of dynamic there that if we can give ourselves the gift of doing that on the upfront, I think can be a huge win in just maintaining that peace and healing of that moment right after baby's born. Elizabeth, do you want to add anything to that offhand?
I think that was so well said. I would add that for everybody on the call, whatever you decide makes sense for your family is good enough. And to give yourselves permission, and partners, right, who perhaps have either a different perspective or perhaps do align with your values around COVID, it's good enough. And to really listen to your instincts, right? If you're feeling physiological symptoms about a visitor coming or a phone call, pay attention to the information in your body around COVID, especially now. And, I feel for all of you going into this, but stay connected to your instinct.
Yeah. And I think that's beautiful even to talk about again before baby's born. Like, what do we do if I feel really weird about something? Do we have a code word? How do I communicate it to you so that again, you're not in this moment trying to navigate this emotional difficulty while also just trying to orient yourself to a brand new existence. So I think as much as you can communicate to your partner and to those you love beforehand, the better. So I think that's another really doable action item that can be on that list that I know is a beast. It's not fun. It's a beast. But again, that template I made with my sister, it was funny. I was like, let's give a nice update on baby. Let's say something loving. Let's lay out the guidelines. We do it with love and the hope that we're just creating a sense of peace for baby and for mom and for partner. So that's on the list. Okay, next up, now these women really, here it is. I was just saying before we logged on that one of my moms talks about her team as like her board. She, as a woman in the world, has her board of people who help to take care of her. And I love this idea that even from before you become a mother, you're thinking about who is here to support me so that I can be the emotional hub of the family, right? That is a job that most often falls to mom. That is a challenging job, especially if we are not full ourselves. So realizing from before baby is born, you deserve a team of people who are helping you feel your best so that you can give your best to your families. So welcome to my board. And so I always invite my expectant mamas to make some appointments for them, their postnatal selves while they are still pregnant. And you're like, that's silly. I'll have the baby. And then if my pelvic floor is falling down, I'll make an appointment with Flora. But you won't. You really won't. That's the thing. That's the problem, is that there's so much going on that in just giving ourselves the gift of an appointment already on the calendar, if it's not there, you're going to go, it's fine. I'll be fine. In a couple of months, I'll deal with it. It's fine. I'll be fine. In a couple of months, I'll deal with it. If it's on the calendar, you go, oh, right, Friday, I get to see Flora. First, how the do I get to the doctor? Okay, let's talk about that. What's that going to look like? Blah, blah, blah. But it's there and you'll have it to go to versus waiting to make it. Especially in the beginning, we just don't have the bandwidth most often to be like, I'm going to do something for myself. But if you've pre-planned to take care of yourself in these ways, to hold space for if you need help, you don't need Flora, you're not peeing yourself every time you think the word pee like I was, then you cancel the appointment. But if you do need it, it's there for you and you have taken care of yourself from the beginning. We're getting a question real quick. Let's see, can you clarify appointment about the pelvic floor? Yeah, so Flora, you wanna just jump in with what that, is there a general, I was like, I need to see a pelvic floor PT. I'm peeing myself all the time and I can't stop, was kind of what it sounded like when I called for Flora, but is there a different way one can say what they're looking for?
Yeah, I think that basically, just to say off the jump, anybody who's had a baby can have a pelvic floor assessment and visit, can benefit from that because you've had a baby pushing down on your pelvic floor muscles and you've also delivered a 7-pound baby's head through your pelvic floor muscles.
Mm-hmm.
So whether you carried or delivered, and this includes even if you had a C-section, anyone can benefit from having pelvic floor physical therapy to make sure that we are re-educating those muscles to get strong again, rehabilitating what might have got stretched or might have gotten weak. And pelvic floor physical therapy is not just about Kegels. And I want to make that clear because sometimes people think, well, I just was told to do a bunch of Kegels and everything should be fine. And what we do in physical therapy goes beyond that. There is a whole lot of function that is incorporated from the core involved with the pelvic floor. So that's pretty much it in a gist, and I can go into more detail later.
And Allie has a great question, which if you don't know, I think is really important. Is this a specialist, and can I get a recommendation from my OB? And yes, most certainly pelvic floor physical therapy is but why don't you answer that question, Flora? I won't.
Absolutely. No, my pleasure. Yes, you want to find a physical therapist that specializes in pelvic floor rehabilitation. So there are some places you can go to and look up. I'll give a website to Nicole later. You can put in your zip code and you can find a pelvic floor physical therapist in your area. And for the most part, you can ask your doctor if they know of a pelvic floor physical therapist that they would like you to go see. But you should basically just pretty much pull up pelvic floor PT, and you should hopefully find someone in your area.
And also to say, which we mention a lot when you're in my groups, a pelvic floor physical therapy appointment is standard of care postnatally in a lot of areas, in a lot of places. It doesn't happen to be in where we are. And so this idea that something has to be wrong for me to need this appointment, I think is something that also, if you have the ability to make the appointment and keep the appointment, just to go in and say, yo, there was a baby on my pelvic floor for 40 weeks and then that baby came out. How are things down there? Is there anything? Oh, she brought her. I love it when she brings her pelvis. Just tell me how things are going following up. So I think even this idea that it has to be for something being wrong versus like, hello, pelvic floor, you did a great job. I'm going to take you to the doctor because you did such a great job just to make sure everything's okay, is another way that we can think about pelvic floor.
And really quick to that, Nicole, I just want to say, if it's common, it doesn't mean it's normal. So if you may hear people saying, well, I pee when I sneeze, and, when I run, I had an accident, or, every time I have sex, I'm in pain. If you hear that, that doesn't mean because you hear it, it's normal. So just that's a flag.
Another great question coming in, and let's cover the pelvic floor now. Let's cover our flora-ness. We're going to cover it now. How long after is best to make the appointment? So to go back to say, how do you make the appointment? I think it can be as simple as, hi, my name is Nicole. I'm 32 weeks pregnant. I'd love to make a postnatal appointment with Flora. I'm due in, whenever, and make the appointment. It can be that easy, I think. But Flora, how long after, do you have a time when you feel like it's quote unquote best?
Some therapists vary with this. So some physical therapists may not want to see you for 6 to 8 weeks after you've delivered, because they want to make sure that maybe your incision is healed, where your scar is, or that, you're just in a place where you're feeling a lot stronger to come out and see a physical therapist. I personally love to see my moms right away. And the reason why is because I've had moms 2-3 weeks after delivering having accidents, going for walks and having to go home and change their pants. And I don't want anyone to wait 3 weeks to come see me for that. And I'm also going to want to educate my moms on, this is the way you should be sitting when you feed your baby, or this is how we're going to start to strengthen your core after you've had a baby, stretch your abdominal muscles, and has created maybe an instability now in your core and in your trunk. I want to check in with them also, because I want to know, how are they feeling? And this is when I may want to refer to someone like Dr. Barron with regards to, are they feeling maybe the baby blues, and these baby blues are going beyond 2, 3, 4 weeks. That's an issue for me. I may want to see someone like Dr. Gabriella, because now I want to know, can you get your hormones looked at? Things have changed physiologically in your body. And even after you've had your baby, your body is still recalibrating, and not just from a blood standpoint and a hormone standpoint, but from a joint standpoint and a muscle standpoint. If you're still breastfeeding, your hormones are still all over the place. So I want to make sure that I'm getting my moms to be as successful as possible as soon as possible. So yes, you can just call and say, hey, I'd like to come see you for pelvic floor physical therapy. when can I come in? You may ask your doctor for a referral, like I mentioned before. I will say as a caveat, some doctors may not think you need it, which I think is sometimes a disadvantage. So I want you to also advocate for yourselves and say, no, I really would like to go see a physical therapist. Could you refer me to someone or ask a friend?
And I think this is one of the, you said this, I just want to highlight it because I think this is one of the first things you and I really connected on, Flora, is that for a lot of us, we have come to associate things like incontinence, pain after sex, pain with sex, whatever the thing is, as inability to jump on a trampoline, inability to do inversions during yoga anymore, as like a normal byproduct of, well, I had a baby, therefore X, Y, and Z. And a lot of these are things that don't have to be things that we live with. And so again, to that point of advocating for yourself, and it is a beautiful one. So just because it's happening, just because it happened to your mom or your sister or whatever, doesn't mean it has to be your reality forever. Also, if we get you some, put Flora on your board. And I also want to say this about everybody as we're sitting here talking. So you like find a pelvic floor PT and you're 30 some odd weeks pregnant, you can go see them before the baby too, and say, hi, how's it going? And this is a huge one with Dr. Francis. I saw her throughout both of my pregnancies, but also very much at the end and Dr. Francis will talk about this in a second, but also to just help me, my body deal with all the things that my body is dealing with and to help me be more comfortable. And now I have a relationship with these women and an appointment after. And oh my God, I can't wait to talk to Elizabeth in a few weeks. Oh my God, I can't wait. I've got Dr. Francis. I know I've got her. So there's that connection too. And talk about like what to do in those last 40 days. Find the provider, make the appointment, go see them. That's also something that we can do with that energy in the end that is very active and very empowering. To know that you have people out there looking out for you is very empowering and very calming in a time when I think we can feel very afraid and alone. And also these women and women in this field and just people in this field in general hold space for this sort of experience all the time. When we are pregnant, especially for the first time, especially if there's been any sort of trauma getting to that place, we can feel like we are alone and the only ones who have ever experienced this and terrified. And the more you normalize the experience by surrounding yourself with women like this, we start to feel calmer and more empowered because it's more normal. So I think that's all, those are all really beautiful, important things, Flora, and lovely things you brought up as part of that. So thank you very much. And we'll take more questions for Flora at the end as they come up. Next, I'd love to chat a little bit with Dr. Francis. Obviously, I think we said this in her bio. She is a one-stop shop for all things natural, and was a huge resource for me just in helping me and my body get through our pregnancies and come back from my pregnancies afterwards in a place where I felt really supported and cared for. Dr. Francis, will you talk a little bit about why it might be good for, so the appointment I say is make 2 appointments. Blood work is a huge one. Get yourself some blood work after baby is born. Dr. Francis will talk about the battery in a second. And see a chiropractor if that's something that you are comfortable with. And can you talk to Dr. Francis why those 2 things might do for ourselves?
Well, from the structural perspective, and this really ties in with Flora's work, while you're pregnant, your body's producing a hormone called relaxin. And what relaxin does is it weakens the ligaments so the pelvis can widen. And what happens is after the birth, and that's also what makes people wobbly as they get bigger and bigger. So as people are moving into their 2nd and 3rd trimester, I'm doing monthly body work like massage and chiropractic to keep things lined up. And I always recommend that they have good arch supports in their shoes, that they're doing some kind of physical therapy just to keep their alignment and prep. But what's really important to know is that after the birth, between week 8 and 12, the relaxin starts to reabsorb and the ligaments start to tighten up again. And so this is a very essential time for people to get their alignment reset. So I usually recommend that people do massage and alignment. I do a massage and adjustment combo, get everything lined up. I also do the Mayan massage at that point. And the Mayan massage is a massage that realigns the uterus and the ovaries. So we want everything in the right position so that when it tightens up, It tightens up in the right position. Otherwise, a lot of women end up with chronic back problems. And it's harder to work through once it's all tightened up. But after that, I usually always recommend PT and physical therapy and pelvic floor work, because you've aligned things first and then you're strengthening it in that proper position. That
And
makes
also
sense?
to say, after baby's born, I was talking this with one of my moms the other day, like, you're just trying to feed the baby, right? You don't care how you feed the baby. You're just trying to feed the baby. And your body is doing a lot of work and can be quite uncomfortable and can be tweaked, can be twerked, can be all sorts of things on top of, yo, I just birthed a baby, however I birthed the baby.
Very good point.
So having some sort of a body worker like Dr. Gabrielle, who also is very familiar with the female experience of giving birth to support you appropriately, I think is really, it's just important on so many levels. There's what's going on with
One other thing, the alignment of the uterus can very much be, it's not just the pelvic floor being weak that causes the incontinence. A lot of times if you have your bladder and then the uterus behind it. Okay, a lot of women post-birth, the uterus is folded. If it's folded forward, it's pushing on the bladder. If it's folded backward, it's pushing on the colon. But when that uterus alignment is off, it can cause either bladder or rectal problems. So the Mayan massage is actually a massage that realigns and repositions the uterus and the ovaries. And yeah, that can really help with the incontinence and the rectal problems as well.
Dr. Francis, will you talk to a little bit about blood work and why it can be important? And again, we'll have a resource for a list.
Yeah, I think it's shocking that they don't actually just recommend blood work for all women after birth. Because if you think about it, this was the garden little Junior was growing in. And they've been living in that garden, but also like your adrenal and your thyroid are the battery in the gas tank. And for that entire 9 months, you and Junior were charging off the same battery and gas tank. So baby comes out and you've been, you're a little bit sucked clean, right? So what I recommend is in that first 2 months after birth, sooner than later, but a lot of women are so overwhelmed immediately that it's too much. But I have a postnatal blood workup that looks not just at the body of the car, because medical doctors are typically looking at the body of the car. How's the blood sugar, how's the liver, the kidneys, all that, those general health screens. I look at all the vitamins and minerals because we want to make sure that all those things are nourished and at good levels, because we need to replenish you and we need to make sure that the breast milk has all the nutrients it needs for the baby. But also I want to look at the gas tank and the battery. That's the adrenal and the thyroid and all of the sex hormones. And we want to really build all that up if there's anything that's depleted. And it's those depletions in hormones that are the main cause of postpartum depression from a hormonal and chemical perspective. Postpartum isn't all just being lonely, and it's not always, I don't really want this baby. There's a lot of it that's really hormonal and chemical. And when you can kind of make sure that that's taken care of, then you really deal with those kind of more personal, emotional issues in a clearer way. You don't have to deal with it from that hormonal perspective.
Which actually feeds into Elizabeth and your work in such a beautiful way. There's like the system-based things that, like, okay, let's check those off. Let's make sure that mom is replenished. And then another appointment I always say to make is with a mental health professional who either you already know and have that relationship and rapport with, or who specializes in maternal health issues, just because it's a specific and unique time, which Elizabeth, you do. And will you talk a little bit to the importance, what we want to look out for, and all of that goodness?
Absolutely. So much. So, what I would say to start off is we've talked a little bit about the massive physical and fundamental shifts that are happening in a woman's body. And just as so, right, there are unbelievable psychological and emotional changes too. I would say spiritual as well, if you're someone who spiritual practice, right? And so what's really missing often for pregnant women is this experience of like how are you doing? And not just, are you peeing when you sneeze, right? Even though we need to know that too.
Yeah.
And have you had a hot meal, or are you so busy nesting that you forgot to drink a cup of hot tea? Because we know warming, as Dr. Francis said, is essential. But like, how are you really doing? Are you scared? Are you anxious? Can you not turn off the thoughts? Are you extra irritable? Like, does that feel like pregnancy irritable? I think there's so much that's shifting. We call this matrescence, this unbelievable shift. And for me, I get so frustrated often because we're talking about in pregnancy physical things like preeclampsia and gestational diabetes, but we're not talking about things like perinatal mood and anxiety disorders, which is this really, really long-winded, annoying term, which is probably known for everybody on the call as postpartum depression, right? But we have to use PMADs because it's an acronym that encompasses a wide range of illnesses that occur both in pregnancy and postpartum. They are so common. Like the literature says 1 in 5, but those of us here who do this work know it's like 1 in 3. I'd go so far to say there's new literature coming out right now about COVID that it's really 50% of moms, right? That's how common. The rates of anxiety and depression in the pandemic are 3 times what we ever saw.
Yes.
And so with that said, by meeting a clinician like myself in pregnancy, where I can learn more about your story, who are you before this baby? Where are you at baseline? Like, how's it going? Are you pretty much like where you typically are? Are you more elevated? Are you underneath sort of this experience of, I don't feel really like I know myself right now emotionally? It can be so profoundly helpful to have a space. I love how it came up before. Like, why do we think we have to go to an expert or a specialist or some sort of clinician when something's wrong? What about sort of the proactive conversations about, you know, maybe I do want to talk about how I'm mourning the loss of my relationship with my partner, that it's going to change, that we're welcoming a third person into our relationship, right? Or perhaps the identity shift, or what might change with work, or the fact that, you know, you're riddled with maybe guilt about the fact that things are changing, or, I mean, there's so much that comes up.
Elizabeth, will you talk about this a little bit too, this concept that like, because I think this can be a barrier for some women. I can't both, this idea that I can't both love this little being more than anything else in the world and be upset about anything else, be distraught about anything else, feel anything that is not beautiful without also then somehow being a bad mom. Can we normalize that a little bit?
You know, it's my favorite topic. I mean, part of it, I do want to sort of say it's not your fault, moms, right? If you're feeling like it's so hard to sit with feelings that are uncomfortable, or perhaps they aren't being talked about on Instagram and all the blissful sort of posts, or on the Pampers box, there's this beautifully coiffed woman who looks like she showered and brushed her teeth, attuned perfectly to the baby on the box. And you're like, how come I don't feel that way every single day? I feel that way sometimes with my baby, but not always. So Nicole is sort of tinkering on this big topic, this big sort of modality of treatment that I use in my work, and so many perinatal therapists do, which is called the dialectic. It's this term that helps us tolerate 2 opposing feelings that exist at the same time. Now in life, I don't know about you all, and he can hear me, like I love my partner and sometimes I want to strangle his neck, right? Or I love my, well, I wouldn't say love my mother-in-law, but you know, there are people in your life where it feels easier, or your job. I love my job and often I get burnt out. But with babies, we just feel so much shame and stigma if we talk about them in the same way. And so I'm here to sort of say, one, if you're feeling at the end of pregnancy, as you prepare for the first 40 days, like you're both excited and terrified, that's normal. And I want you to sort of practice this dialectic at home. Yes. In addition, if you arrive in the postpartum and you're feeling like I miss my old life and I'm madly in love with this kid, also normal, right? So I am so excited he or she is here. I hated the end of pregnancy. And wow, sometimes I fantasize about being on a beach and reading a book because maybe you haven't picked up a book in 6 months, right? So just really making some space for the fact that 2 opposing things can exist at the same time. It's normal, it's human, and allowing yourself, right, to find some space, whether it's a clinician, it's a group with Nicole, it's with Flora, it's with Francis. where you feel comfortable, right? Having people around you that say, I understand, and it's normal, and I feel that way too.
Totally. I love, so a couple of things I want to mention, and then, but I want to ask Elizabeth the same question in terms of timing, because Flora and Dr. Gabriella answered that. Do you have a like, now if week X is a great time to make this appointment for?
I would say, I mean, really anytime. I was about to say about halfway, I really prefer, so that also like you, we can play like a conductor of care type role. So whatever's sort of coming up. But what I will say, and I've never sort of articulated this before, is the first trimester too. So for our moms that do this again, maybe,
Yeah.
right? It's so isolating during that time. So if you can find a perinatal therapist, and please feel to reach out to me. I can give you also PSI's information, right, which is nationwide for our moms that are all over. But what an isolating time too in the beginning, riddled with fear, right? And so to find someone, I think in the beginning, really as you're learning the news, to help follow you is profoundly helpful.
Amazing. Thank you for answering that. A couple of things I want to mention in terms of things that are on this checklist for me. I always like to make sure, and one of the things that I do is train women physically, prenatally and postnatally. I always like to say, look now for some sort of postpartum exercise that is going to be targeted to your body that has just had a baby. And Flora will talk to this, Dr. Francis will talk to this in their work also, that like doing that deep core recovery to say, to that deep core canister that just birthed a baby, hello, let's get you back online, then let's go back to running marathons and whatever, can go a really long way. And this ties very closely in with what Flora does, to making sure that you feel like a fully restored version of yourself, and you're not in these physical activities thinking that you can't do X, Y, or Z anymore because now you've had a baby. It doesn't have to be the case. You can do things you've never done, feel stronger than you've ever felt. All of that is possible. We want to make sure that we just start with that deep layer first and do recovery there before we add on the other things. So I like looking into postnatal activity. We have some amazing postnatal classes and prenatal classes at Union Square Play if you want to come hang out with us there. Oh, and don't forget to put mama on the registry. Anyone who wants, I have a mama registry. Like if you think about what you want this experience to be like those first 40 days, you're probably not in your husband's sweatpants. Maybe you are. You might be, whatever makes you sing, makes you sing. You might not be in your partner's torn up sweatpants wearing whatever fits, trying to get those disposable underwear to not leak off the side anymore, right? Like in your head, you're probably in a pair of pajamas that feel lovely. You're probably right. So like put yourself on the registry list. Also, again, put your oxygen mask on so that then you can take care of little one. So that's kind of the extent of the list, which we'll send you that checklist. I want to make sure we open up for questions now. And if we just dive right into questions, there's a question for Flora, for someone who is already 30 weeks and having issues with incontinence. Is there anything that can be done? What can we do even at 30 weeks pregnant?
Absolutely. So just real quick, here's my pelvic floor model, and just
I love her.
just an appreciation of, so this is the front of the pelvis and this is the back. And if I have you laying on your back, and this is looking from the foot perspective up, just to give you guys an idea, that's the head of the clitoris, that's the urethra, that's the vagina, and that's the rectum. And as you can tell, these muscles are kind of like a carriage. They hold your organs inside. Now add a baby that's growing, and now these muscles are going to get further stretched and further compromised. So what I would suggest you do at 30 weeks is start looking for a pelvic floor physical therapist, because we work with pregnant moms as well as postpartum. And I would want to see, first of all, are you using these muscles appropriately? And are you able to perform a contraction to help start building maybe some strength where you may have become stretched and weak? And so that introduction of muscle contractions, which are safe during pregnancy, will help start to hopefully bring in the tension that you need to maintain continence throughout the day. Okay, so it's very fixable. Pretty much most of the things that you're going to be going through in pregnancy and postpartum are fixable. What is definitely sometimes hard is after you've had the baby, then there may be some incontinence to deal with then, and there may be feelings of things falling out. So You know, you may feel like your body is just irrevocably damaged. It is not. These things are all fixable. Just come and find people like myself, Dr. Francis, Elizabeth, and you know, these things can be treated.
Beautiful.
Did I answer that question?
Yes. Oh, here's another question. I think you answered that beautifully. Do you recommend, I have one of these for myself. Do you recommend the LV for Kegel exercises? And should we be using it before as well as after baby comes?
That's a great question. So the LV, for some of you who may not know, is an actual pelvic floor trainer that comes with an app. And what you can do is insert it into the vagina. And what it does, it kind of measures the ability for you to perform a pelvic floor contraction. When I have my moms pregnant coming into the clinic, I want to see that their muscles are able to do three things. They can contract, they can relax, and they can bulge. And what the trainer might help you do is learn to do these three things. The bulge is important for bearing down and being able to get the baby to pass through the vagina. I have seen moms who do the opposite. They don't know how to bear down, so they squeeze instead. And that might cause a little bit of trauma to the pelvic floor musculature if they don't understand what's happening. Now add an epidural and you can't feel what's happening. And so now there may still be some more confusion. So I like to watch and see that my moms can do all three motions in preparation for delivery. And I think it's a great idea to start to slowly practice this or have someone trained in pelvic floor therapy that can watch and see that you're able to move these muscles appropriately and time them with a bearing down, which is what is going to allow with the core muscles to facilitate the baby passing through.
Amazing. Thank you. So it's a go for the LV beforehand as well.
Yeah. And just real quick, a caveat, like an LV is not a good replacement for having someone watch.
Yeah.
And in some cases, postpartum, having someone feel. And I do a lot of internal manual work to make sure that it's not just what I see, but that I feel those muscles actually firing on my finger, or that I can feel something that's maybe tight and I need to manually release that so that it can fire appropriately once the muscle has been released and has been now brought back to its natural state.
Mm-hmm.
So one doesn't replace the other, but it's a good adjunct or a good option if you're kind of in a stitch.
I think why I liked it too, my a physical therapist assigned it to me after my second, was because it gave me like a, rather than like do your exercises and you're like, yeah, I'm doing my exercises. You're like, oh, there's like an app with a 5-minute thing and you set a goal and you've like got this thing and this thing. It was helpful for me in terms of like really not only like knowing what I was doing, but then also getting me to do it. I liked it for
good biofeedback, because you can see on the, oh, my muscles are actually getting tight. Oh, they're relaxing. It has a visual feedback, which can be helpful when you don't know what's happening down there.
Other questions that are coming in? I'm sure there's plenty we can talk about if they don't come in. How are you guys doing out there? How are you feeling, mamas? You can also just tell us how you're feeling. It's a long list. How are you? Oh, let's see. I know, girl, I know. I can't even imagine at this stage wanting to be pregnant a second time. It is one of those weird nature voodoo things that somewhere around a year, for me, it was a year. We like had my daughter's 1-year birthday and I was like, that wasn't so bad. Let's do that again. Like, it's really, it's a trip. It is totally a trip. But how strong are you that you're doing it now? That's the thing. Like, it just, I want you all to recognize how strong you are that you're doing this now. It's huge. Any advice for itchy nipples and early colostrum coming out? Anybody? Dr. Francis?
What was the question?
Itchy nipples.
A lot of times itchy nipples could be that there's like a little bit of candida or yeast overgrowth in the body, and it could be coming like through sometimes that's like the first thing you see before mastitis. So it's definitely good to kind of have that, make sure that it's not coming through the breast. But for the topical itchy nipples, there's some good ointments that use like calendula and coconut oil and different kind of gentle herbs that are safe for the baby to kind of put their mouth on. But I think coconut oil is one of the best ones because it's good for yeast too.
Yeah. It was funny. That was one of those woo-woo hippy-dippy things. I had a tub of coconut oil right next to the diapers. Did you use the coconut oil, Elizabeth? That was like our diaper cream for...
I was just going to say, Dr. Fran, I was going to jump in and say on a personal level, I don't know professionally, but on a personal level, I was lathering with coconut oil. It was the only thing to help. And for me, it was really like more of an eczema picture because I delivered in March and it's freezing. So
Coconut oil is really good as an anti-inflammatory, but it also has antifungal and antimicrobial activities. And it's really good for the immune system, and it's totally safe because you have to think whatever you're putting on there, the baby's going to take in directly. So it has to be something safe for the baby, because there's a lot of things people are putting on like Vaseline. I'm like, well, that's petroleum. I wouldn't want the baby like sucking on there with petroleum on there. So it's really much better to use something like coconut oil that's completely natural.
Thank you for, and again, questions as they come in. Recommendations about specific books, exercises, PT to prepare the pelvic floor for labor, and looking for a postpartum doula to assist. Any suggestions as far as how to decide how many nights, weeks to book in advance? That's a great question. Looking in terms of tests, great question. And just like, how are we taking care of this baby? Who's going to help us? And I love so much that you're looking at a postpartum doula. What I love about postpartum doulas is that they are really looking at supporting mom doing the work of mothering. So they are often going to support feeding, sleeping, showering, breastfeeding. How do we help mom do this work? Which I think is such an empowering way for mom to get help from her whole team, is not take this experience from me, but give me what I need to meet this experience and to meet me as this fierce warrior mother. And I think that's a huge thing. Advice on how to find them. I think, again, going to care providers you already trust can be a great starting place. Going to friends who had an experience that worked for them. I'm sure Instagram is a place but looking locally would be a way. I found my doula through my midwife. They had worked together before, and I trusted my midwife no end. And so that was the way that it worked for me. And I've since used my midwife and my doula to find other resources. So I think start with someone who you trust and who works in a way that you like, and go from there. But I love that question for sure. Does anybody else want to say anything about that?
I just wanted to add a quick point about the postpartum doulas. I echo beyond what you have to say about how they're really there for both mom and baby, not just for baby care. And really why that's also essential, right, is that you're so used to in pregnancy being asked how you're doing, how you're doing, how you're doing. And then when baby arrives, there tends to be a transition into how's baby sleeping? How's baby eating? Is it gaining weight? And going, and postpartum doulas can really come in there and help to ground and center and think about the family. So I love doulas, and please reach out if you need help finding. Yeah.
Great. So there's a resource for you. Elizabeth, question about, and this one is very near to my heart, questions about any tips to separate past fertility traumas from fear of having healthy pregnancy baby. Guessing the answer is a whole bunch of therapy. I can answer this from my spiritual perspective, but Elizabeth, please jump in here with anything that's coming to mind about how to do this.
Do you want to go first about spiritual?
No, you go first.
This is about trauma?
Yes, how to separate having had a difficult fertility experience from and allowing it to be different than what this birthing experience will be.
Well, I was reading another question that came in before, which is why I was distracted, which was praying with COVID restrictions that my partner had in the delivery room. And right, I can really speak to that also on a really personal level. I had to deliver my daughter in March of 2020 without my spouse due to the fact that it was the beginning of this nutty COVID-19 pandemic that we're still in. And so it can really speak to, right, as my husband and I are hopefully preparing to be having a second, right, to be able to find your board of directors, no matter what you've gone through, right, to lean on other fellow women who are also strong advocates for you, to really, really sort of accept help when you've been through any traumatic experience and know it can be different. It absolutely can, like everything else in life, right? Nothing is perfect. Most is imperfect. And we really, really have to find the right support team, I think, to be able to integratively really sort of garner the traits inside of us that are maybe sometimes even unconsciously we're unaware of, like how strong we are as women and human beings. So yes, a ton of therapy and an integrative model, right? And really sort of talking to friends and family members about maybe what, and then we can talk about this more or contact me offline, right? But like maybe coming up with some scripts about maybe questions that you want to be asked or ones that are off limits. For example, you go through a traumatic trying to conceive journey your first time, you have recurrent loss. Sadly, this is so common, so not talked about. And then the second time around, people might say, so no baby yet? Are you guys trying? What's happening? And it's like, no. We don't want to be asked about that. We want to own the conversation, find some control. I hope this is helpful just to sort of think through possibilities.
Yeah, totally. And I think also I want to highlight, Kisa, I hope I'm saying that right. I love that name, is my best friend's name. How beautiful it is that you are, the knowingness to ask the question and the knowingness that the answer is there. The desire to separate the previous experience from the birth experience, to allow them to be different. And just to recognize that, like, your gut, which becomes your mama gut, right? That is your inner self. We have this knowingness that I think a lot of us really get to know as mothers. And it's so present to me in that beautiful question that has within it its own answer that was already there in you. And I think that's just a really beautiful part of this experience of the spirituality of motherhood. There was a follow-up on the doula thing. How many weeks? I think that is individual to all of us. In my own experience, I would say, for me, for sure, those first 2 weeks, I had my sister as a postpartum doula both times, and she was there for about 10 days to 14 days. And that was like, those were the most, to me, like a snow globe just shaken up. I don't know how to say that, shaken up. And having somebody else there who was there to support feeding and sleep and those sorts of things was a game changer for me. So I would think at least 2 weeks, maybe a month, but that's something that you can talk to them about when you interview them about what's best, because certainly they're going to know better than I. Let's see. Anything else? There's more here I want to make sure we get to. Let's go for a couple more, guys. Do you have time for a couple more?
Yeah.
Can you have an only postpartum doula and not a prepartum? Yeah, they actually, postpartum doulas and doulas who are with you for the delivery period are actually, can be, and I would think almost more often than not, are separate because they have different specialties. One is helping you with that birthing experience, and the other is trained in supporting you in the aftercare. And I just can't stress enough how the labor experience and those early days after are so formative for our experience of motherhood and the story we tell ourselves. And so to have that support after is just a game changer. Let's see, are there bad experience with an OB? I will just say quickly, you deserve a team that supports and empowers you. You are the patient. You are paying the bills. Find someone who supports and loves and honors you is what I would say to that. And if you had a bad experience or your gut is telling you you want to change, you deserve to change. And so that would be my quick response to that question. I wish for you to feel supported by your team, and you deserve that. It should be the norm, not the exception in this country. I'll get off my soapbox now. Thank you for joining us, Liz. Guys, any closing thoughts? Thank you, Dr. Francis, so much for being here and for all you do in my life. Laura, thank you for being here and for all you are. Elizabeth, thank you for being here and for serving the way that you do. Do you women have any final questions, or not questions, statements, things you want to say, anything?
Yeah, I would like to just say something I see really commonly in this transition period is that there's a lot of grief and sorrow about the part of their life that they're losing, as well as excitement about what's coming. And I see that pretty much across the board. People sometimes don't want to admit it. I have to coax it out of them.
Yeah.
But I think you can be sad about losing that free part of yourself and excited about that at the same time. And one of the things that I think besides therapy that can be very helpful is to create some type of like transition ritual, either by yourself or with your friends or with your partner, because you're kind of like, there's a death and rebirth going on of these different archetypes of ourselves. And we don't really in our society have too many transition rituals and rites of passage anymore. So we can create those and make them meaningful for us.
I love that as something that's on this list, a rite of passage ritual for yourself, whatever that means, however that speaks to your spirit. I think that's a beautiful thing to add to this list, Dr. Francis. Thank you so much. Quickly tell us where we can find all of you over on the Insta, which is how we find the peoples now a lot of times. Dr. Francis, you're Urban Alchemist, is that right? Are you at Urban Alchemist?
At the Urban Alchemist, and I'm going to be giving out some handouts that have the diet and a breastfeeding smoothie and a list of blood work to ask your doctors for, and I'll put contact information on that.
Amazing. Miss Elizabeth, where can we find you?
Oh my goodness. Well, my website for right
question. It might be on
elevatec.com. Please definitely be in touch with me.
Amazing. Flora, this is a big one. Miss Flora, where do we find you on Insta? I always ask Flora this question. She hates it and loves it at the same time.
I need to work on this. I'm on Instagram though. I'm on power.lillynyc, power.lillynyc, or you can email me at floracohenpt@gmail.com. So if there's any questions any of you may have had on pelvic floor, please, please, please don't be shy. Shoot me an email. I just want all moms to know that, you know, in that time after the baby's been delivered, it's when I see that my moms sometimes feel like what they're going through is very lonely and isolating. Just know that you have a space and you have a group of people here that are here to support you. I definitely, I'm very interested when I spend time with my clients to hear their story. And so just know that I would be happy to even see anyone through Zoom if that was even an option for them as well.
Thank you guys. Thank you so very much. It has been just a gift to hold this space with all of you. I hope we've answered some questions and given you a good doable list. More to come. We'll send everyone who participated tonight a copy of the video and all the things so you can make all the lists. Love and light, everybody, with great respect. Good night. Thank you.
You,
Love, ladies.
Thank you.
Bye.
Bye.